that, and because of eating, eating, every day, yes, it's high fat, and then the carbohydrate, sometimes, in fact, according to, the nutritionist, that for a child, it's recommended to take 4 servings of fresh fruits and vegetables with 5 colors in a day. But in Malaysia, that's what's happening, according to the survey. 0.91 to 1.07 servings per day only among Malaysian children. That means almost like 1 per day. And it's not up to the requirement, less than 50%, almost like 1/4 only. So what will happen? I already told you that it's very important to have vitamin and mineral. This one provides vitamins and mineral and fiber. And there are, for example, 50% of important ingredient of the cell already lost, and the cell cannot build well, cannot be built well, cannot be created well. So the cell will be unhealthy. When the cell is unhealthy, the body will be unhealthy, right? Correct or not? And this is what happening among our children in Malaysia. So should we have a solution? Can we force the children to eat what they're supposed to eat? Actually, quite difficult. That's why we need to make sure that at least they have some supplement. Because of this lack of nutritional gap, so that's why there are so many common illnesses at a typical outpatient clinic. Actually, if from my experience, for a baby, when they go to nursery, usually after 6 months to 1 year, after they go to nursery, in a year, they will come to see me at least 7 times. That means they come to see doctor 7 times, they get sick. Some of them every 2 weeks come to see me. And if they are staying at home, at least half less clinic visits. So that is current situation now. And of course, if they prefer to eat all those, just now they're exposed to the fast food, whatever, they also come to see me more. So that is the problem. And I can see very clearly that the way to do is not to give them medicine only. Because give them medicine is a quick fix, but it doesn't cure the underlying problem, right? Now you know what is the underlying problem. So we as parents, but you not depend on the doctor. What as parents, we should know what to avoid and what to reduce and what to be given. Okay, so that's why they have all this, and this creates so much of headache to parents, right? Runny nose still okay, but at night they cannot sleep because blocked nose. And vomiting is so scary, vomiting, they may become dehydrated. And you Google, it's so dangerous, right? So you may want to see a doctor immediately. Diarrhea, they also can get dehydrated, and the buttock becomes so excoriated, red and painful. They keep on crying the whole night. Abdominal pain, of course, is very painful. And wheezing can be life-threatening, It can be part of asthma or due to some pneumonia or underlying wheezing infection, viral infection. And this is so common, in my clinic or in a typical outpatient clinic. And eczema is so common nowadays. So these all are related to what I've shown you, the current situation now. So what can we help? How can we help our children? Yeah? Actually, the most important person is not our children, it's we ourselves as parents. Do you agree? I think it's very important ourselves. So what is the first thing to do? Awareness. Accept the fact that this is the situation and we need to do something, not our children need. We need to, not government need to do something, we need to do something, right? Secondly, right knowledge. Nowadays, it's so easy to get the knowledge, but what you're getting, right knowledge or not, is so difficult to decide. So you need the right knowledge, because if you have good intention but do it wrongly, you are harming, not you lah, we are harming our children, right? So if we don't do anything, we don't do anything lah. But we do something and we are harming our children, that is worse than not doing anything, right? So right knowledge is very important. So I congratulate all of you because you are here to get the right knowledge. Give yourself a round of applause first before I proceed. And right action. What are the right actions? So first thing, again, we have to do the right action. I mean parents. Parents show a good example. What good example? For example, if I see a baby come to my clinic, children is obese. I look at the parents, they are obese too. It's always the case, because why? Because parents give a good example for the children. So we need to do something ourselves. Secondly, healthy, balanced diet, very important. Even like iPad, even parents are using a lot of iPad, smartphone, playing games, whatever. Children also will follow. And number 3, consider good food supplement to fuel the nutrition. yeah, obviously that is the way to go, right? Because the nutritional gap is so big, and that was the reason that causing so much of problem among our children, and that are so common, you know, those problems that we are facing and causes a lot of worry. So important, but we need to know what food supplement is the correct or the good food supplement for our children. Number one, the very important one is do no harm. That is so important. That means the safety of the supplement. So how do we know that the supplement is safety? If the supplement must have good quality control during the manufacturing. So if possible, from the plant-based, because we all know that the best thing to give children is fresh fruits and vegetables from a certified organic farm, which is hardly possible, let's say in Malaysia, because there are no organization to certify our farm actually. So it's so hard. But the second best thing is we can give food supplement plant-based from a certified organic farm, right? Harvested from certified. So that is the second best thing. Okay, number 4 is good taste, because children very particular about the taste. But for me, I think taste is important to be good, but not every child will accept, you know, the same taste. So as a parents, we need to know what is good for the children, and we need to find ways. If they don't want to take, we need to find ways to make them take. Not by forcing them, but find ways. I'm sure there will be good solution for that. And affordable price. It cannot be too expensive, and everybody cannot afford it. So important nutrients in the good supplement, which should contain in the good supplement, are macronutrient, as I mentioned just now, protein, and good fats, and micronutrient, which is vitamins and mineral, and if possible, phytonutrient. That means plant-based only can give you phytonutrients, and that includes vitamin A, B, C, D, E, minerals from iron, calcium, and magnesium. These are the 3 most important, and of course, some supplement contain fluoride also. So finally, this is a solution. Because what I think is that is the basic. I think these 3 supplements is the basic we can do for our children. The basic we can do much. So just now I show you what picky eaters. Hopefully with vitamin B, we can help them to have better appetite. And of course, no artificial flavors, colors, or preservatives, because these one are toxins. Artificial are toxins, so we don't want this in our. And we make sure that it is safe and do no harm for our kids. The second one is chewable vitamin C. The question immediately pop up. Hey, just now already got vitamin C, how come you still need to give more vitamin C? What do you think? Actually, the basic vitamin C is just a foundation. We need more vitamin C because nowadays children are exposed, as I show you, so many viruses, and the infection from outside is so easy for them to get sick, right? So we need extra vitamin C, and it must be from a good source. Again, here we have Acelora cherry, and this is one of the richest sources of vitamin C, and it is all from the same one plant, and that is very valuable. It's only second to the fresh fruits and vegetables, and there's no artificial flavor, color, and preservative again. And the third one, just now after you listen to Dr. Nozani, you know that this is so important among the growing children: calcium and magnesium. So, and this one is in to support the bones, and not only bones now, teeth, because children, they are growing so fast, their bone is lengthening so fast. So if you don't give enough, they also get longer, but it's empty inside, or not enough of calcium inside, not too strong enough to support them in the future. They may not grow that fast then, you know. Like myself, I think because my brother and my younger brother, they are all almost 6 feet. You see how tall am I? Because maybe I don't get enough calcium. So your children may blame you in the future if you don't give them enough calcium from a good source, and no artificial flavor, color, and preservative. And with that, now I want to show you a video.